We are back. Welcome back to our next Tuesday topic. Today we're going to talk about shoulder stability, shoulder instability, some anatomy, some stuff like that. So we'll start off with the shoulder itself. A super mobile joint, which we're kind of thankful for. You know, we can have a lot of range of motion. We can reach around. Similar to the hip as far as anatomy, we kind of have that ball and socket, but the hip's not as mobile. Shoulder, we have a lot of mobility. Good thing and a bad thing. So you can picture it like a golf ball on a tee, right? We got this big golf ball, and we got this little kind of a smaller tee. There's a lot of mobility, but it predisposes us for some harm, unfortunately. So that's why we have the labrum in the shoulder, which gives us some stability. So the labrum is basically this piece of cartilage that wraps around the ball. It makes the socket a little bit deeper and gives us a little more stability. Unfortunately, with that, we can get some labral tears. That's what I'll kind of talk about here. So if we look at the shoulder socket here, it kind of looks like a clock. We got 12 on top, 6 on bottom. So slap tear is a labral pathology. It stands for the superior labrum, so the top of the labrum, A to P, so anterior to posterior. So we'll have these tears on the top of the labrum if we get a shoulder dislocation, if repetitive overhead athletes, manual labor, stuff like that, we'll have a lot of tears on the top of the labrum. The reason this happens is because our biceps tendon basically comes up here and it attaches right there. And if we have that shoulder injury, it basically tears right there and we get the top of the labrum, which has some tears in it. So why this is all important. If we have that, and oftentimes we'll see it in patients that don't even have pain, we'll see it on an MRI and they're not necessarily in pain. We can train the heck out of shoulder stability. So get the shoulder blade, all the muscles around the shoulder blade to be strong, to fire, to kind of work together. We can get some awesome shoulder stability to basically protect that shoulder and that piece of cartilage that might be damaged. So long story short, the importance of kind of having all the right muscles around the shoulder blade working around the shoulder, working really well to protect this super mobile and kind of a little bit fragile joint. So hopefully you learned a thing or two. I know kind of long-winded, but if you can take away the anatomy of the shoulder and the importance of kind of strengthening around it, I think you're in a good spot. So thanks for watching. We'll see you guys next week.